ankle mobility, this is going to be working more on the soleus, and so this is a half kneeling position. So you're going to come into this half kneeling position, one leg back. So we're working on this front leg here, this front ankle. You're going to keep the heel down. This is actually ideally done barefoot, but leave my shoes on. So keep your heel down, and you're going to drive your knee over the front of that toe, keeping the heel down on the floor. From here, you can play with where you feel the most tension. I'm going to show you from the front, either slightly inside that big toe or slightly outside that pinky toe. I don't want you driving and rolling to where your foot actually comes up, but you should feel when you kind of translate side to side that there's a little more tension maybe on one side than the other. So if not, then you can just hang out in the middle. What you're doing here is you're putting pressure on that knee to drive it forward and find a stretch up the back of your ankle. So the Pails and rails component is a progressive and regressive angular isometric loading, which is going to be done basically without movement. So you are loading both sides of the joint to generate strength through the range of motion and increase the range of motion. The initial hold is going to be 60 seconds to 2 minutes, whatever is designated, or 30 seconds, whatever is designated on your time, depending on the intensity you're going to bring to this. So you're gonna do your hold first. Your push, or your progressive isometric load, is going to be your foot trying to push the floor away from you. No movement is going to occur, but if it were, you would be doing this, okay? So you should start to feel, as you drive your foot down into the floor, that the back of your calf starts to work. So as you slowly increase, you're going to slowly ramp up into that. So you're gonna think 1 pound at a time, 2, 3, 4, driving down, 5, and as you do that, you can load that knee with a little more of your body weight, 6, 7, and hold. So we're about 60 to 70%. Your intensity depends on your experience with this when you're doing it, the pain that you have, etc. Okay, so if you get pain at any point, you're going to decrease your intensity or decrease your stretch. Otherwise, you're only going to try and go deeper into this. Okay, once you get to your intensity, you're going to hold for 10 to 15 seconds, whatever is designated on your instructions. Then we're going to hold 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, you're maintaining that pressure down into the floor. The back of this calf is working. Okay, now you're going to relax, take a breath. You didn't come out of your stretch yet. Now you're going to try and pull yourself deeper into the stretch. So we're using a kind of post-isometric contraction relaxation technique, but we're using it to generate strength as well. So now that we're here, your heel is staying down, your toes are trying to pull up. They're not actually going to lift, because as you do that, you are driving your knee further forward. But now you're doing it as you work the front of this angle of your ankle, okay? So you're driving the toes up, you're pulling them up as you drive that knee forward, and you're gonna hold for 10 seconds. So 9, 8, 7, 6, 5, 4, 3, 2, 1, okay? And this is the regressive pull deeper into your stretch, okay? After 10 seconds, you're going to relax, take a breath, okay? You're still in your stretch, and now you're going to repeat that. So that entire sequence is one set. So it's stretch, push, pull. So it's 30 seconds to 2 minute stretch, a 10 to 15 second push, a 10 to 15 second pull, and then repeat.